Okay, so what I'm going to do today is I'm going to go ahead and do NG tube insertion. So before I enter the patient's room, I'm going to go ahead and make sure that the doctor requested an order for an NG tube in the patient. And then once I double check that, gather my supplies, and then I'm going to go in the room and I'm going to be like, hi, my name's Ingrid, I'm going to be your nurse today. The doctor ordered an NG tube insertion, so what we're going to do is we're going to put a tube inside your body. And then I would do privacy, put the curtains, and then I would do hand hygiene as well. And then I would tell the patient to state their first and last name and their date of birth, and then to make sure it matches on their wrist, and then also on the chart. And then if on the bed, I'm just gonna make sure I want my surroundings, that the patient's name is on the board, and then the wristband as well. So you just double check, or triple check that this is a patient. And then if the patient put the patient in a high Fowler's position, which I already did, but if the patient was in a high Fowler's position, I would put it in a high Fowler's position. Put the bed rail down on one side, and then I'm gonna go ahead and put regular gloves for this.
Was that conference just for like nurses or like anybody?
That's good. It's a COATN, which is coalition of associated trees.
And then I'm gonna have my pad out, and I'm gonna put it in front of the patient. And then I have maybe my water cup, my syringe, stethoscope, and this is gonna be my lubricant. And then I'm gonna have tape. And then I already have tape on the side right here that I had ready prior. So I'm gonna go ahead and put my NG tube.
See, this one you have to combine a roll ball and a bomb.
So what I'm gonna do is right now I'm gonna go ahead and measure. So I'm gonna measure from the nose to the ear to the, so I'm gonna put this on a little bit, to the xiphoid process.
Go pop something next to them.
So nose straight. So I feel it right here. It wouldn't be like this, but so 50. So then I would mark it with tape, or I can mark it with the Sharpie. I'll go ahead and mark it with tape right now.
I can't get a bomb next to it at all. And then I get a bomb, but there's holes that won't let it drop. Just damn.
And then I would check the nose, and I would double check too if there's no obstruction of the nose, and see if there's a better nostril to use. Okay, so now before I get started, I would go ahead and lubricate it. It shouldn't be a spray, but
I know.
because of, you gotta make sure.
Well, in Gold Fever, where the girl gets like laid out naked and sprayed gold.
Okay, I'm gonna go ahead and tell the patient to extend their neck, so they would like put their head back. I'll take this off just to make it easier. So they would extend their neck, extend their nose, and then I would try to make it like bend it so it goes straight down. And then if I had a flashlight, which I don't, but I would double check inside here too to make sure that it's going down in the mouth. It's kind of hard right now, but I would double check in here with the flashlight, like a little pen light, I mean, and then check that it's going down. So put it down, put it down, I would tell the patient to, once the patient feels it like coming down, then I would tell them to put their hand up. And then I would go ahead and tell them to, or if I had an assistant too, I could, but I would give them the water or have my assistant give them the water, and then I would tell them to swallow every couple minutes, and every time they swallow, that's when I'm gonna go ahead and put it more down. So every time they swallow, go down, down, down until it hits the 50 mark where I measured it earlier. But with these mannequins, it's not gonna let it go all the way down, and that's fine. So after I feel it, like, make sure that you're holding it, because if you don't hold it, it's gonna come back out. And then if the patient is coughing or gagging or choking, I would like recoil it just a little bit, just pull it back a little bit and then go back inside. Don't pull out too far either, but if the patient continues to go and check and they feel discomfort, then that's when I would like go ahead and fully pull out and then start all over again. But the main goal is try to get it and try not to start all over. But if that's the case and they're uncomfortable, then we have to start all over again. So once it's already in,
I was just kidding with the
I go here, right here.
Elva!
And then I would
Another
get the
break,
tape.
huh? Another break, huh?
Put it in the nose.
That's not what you wanted to say.
Maybe Elva would like my plate.
Maybe.
It's not really gonna stick because of the mannequin.
Because you know that website sells some pretty expensive stuff. That Bradford Exchange. That's where those plates came from.
Yeah, I have about 5 or 6 different sets of
It's not a sticky
from
one.
my mom.
Oh,
And
your mom
then,
collected plates.
so
Yeah.
once it's
Kitty cat
secure, like
plates,
I could let go.
butterfly plates
Did she have them all out in like a...
on the wall. Yeah.
And then
They've been
I
in
would
the
go ahead
closet
and
for the last 18 years.
right here.
Huh? I
So
don't
not
know.
on this one,
Yeah.
but on this one, I would put this stethoscope on.
Would you really?
No.
I'm like, yeah. That's gross.
And I would put this down.
Hey, it's still in the plastic.
That doesn't matter.
I would listen to, I would like have their abdomen exposed. I would get the syringe. It should be maybe like around 30 ml. 30.
Do you typically hand out
30.
candy during Halloween?
If they come to my
Per year
house.
of air.
Does anyone come over?
And then depending on the hospital policy, some of them may ask you to aspirate, so that way you check for the gastric juices inside, so that way it's kind of an indication that you're in the
I was
right
surprised they
spot.
didn't have COVID.
Oh,
So
I think they said a lot of people are buying like Halloween costumes this year though, so.
Yeah.
right here.
Do you collect Disney memorabilia? Look what I found in my daughter's stuff. It's been in my garage for
Great.
6 weeks.
Oh my God.
25th anniversary, I think it's.
You're selling it?
Yeah, I'll give it a while. She can get it.
Put it on the stomach. And I will push it. So I would make sure that I hear that whooshing sound. And then I would aspirate after. So I grab the juices and see if it comes out. And then take that. Cool. And then I would go ahead and go for a chest X-ray after. to just make sure that it's in the right place. After the patient comes back from chest X-ray, I would go ahead and like put this like close to them, like tie or like tape it close to them, so that way it's not like things are moving around. And then I would go. So when I send them to chest X-ray, I would document my length and my near, and then how everything went. They come back, I secure it. I put the call light here, and then I would also put the suctioning to low intermittent, and have it like, and then I would connect it here. To low intermittent, and call light, put the federals up, and then hand hygiene, and then clean up, and then walk out of the patient room, and then I'm done.